So the point is right where this top of that arm, and it's not on the chest.
It's not on the chest.
Okay.
It's on the shoulder.
Gotcha. Right here.
Yeah.
Found mine.
Yep. It's really on the edge of the shoulder,
Okay.
right?
You lock your elbow in your body and pull the body away.
Yeah. Watch me.
Yeah.
So that's the coracoid, the inferolateral coracoid point. The superior point, we're actually going to use the head as a lever for that. Yeah, I put traction and I internally rotate it. Traction, internal rotation. Now, the anterior AC joint. So we're going to follow the clavicle. May I expose your shoulder, dear?
Totally.
Nice, thank you. So if we follow the clavicle, remember, so here's our clavicle. Walk down the clavicle. And we come to a little spot where there's a ridge here. Now, here's clavicle. Can I just borrow your pen for a second? I will not write on you. Here's clavicle here, okay? Here on the other side of that joint is the acromion process of the scapula. It sticks up there. And the acromioclavicular joint is the joint between the clavicle and the acromion process of the scapula. Okay? So that's there. And there's a female space there that we would treat.
Is that the upper coracoid or no?
No,
No, we haven't done the upper.
we haven't done upper coracoid. Remember I mentioned upper coracoid we do with the head and neck.
Okay.
So I jumped to the ones, since we've got the arm, I'm jump to the ones we're using the arm to do.
Okay.
And so which point, what is that point?
Hold on, I haven't gotten there yet.
Okay.
I'm just describing the joint so
Okay.
you can locate the point.
All right.
So it's where the clavicle and the acromion come together. There's female space of the joint. The anterior AC is in the front of there, and I'm right on it right now. So if I were to take my pen, here's female space where my tip of my finger is, and there's where the point would be, the anterior AC joint. And for people that have shoulder separation, and a shoulder separation is an injury of the AC joint.
I have that, I think.
Yeah, you do. It's a little bit separate, but it's so old, you know, that it's you can feel the extra bone and stuff around.
I know.
You close it up. I mean, the body builds arthritis to contain unstable joints.
Oh,
So it locks things up that aren't working well.
I see.
The shoulder is exposed. Can you show the other one once more?
Oh, the coracoid?
Yeah.
So oh, you're good. You're good. The coracoid is also, it's not part of the humerus. It's sticking out from the back of the scapula, right? And there it is. You know, let your shoulder go. There you are. There it is right there.
That's the upper.
Well, that's just the coracoid process,
Okay.
right? The point is either inferolateral or it's superior-medial, right? But this is, I'm just pointing it. Take a feel. It's sticking out here. Come on, don't be shy. Right there. No, you went right off it. Follow my fingers. You're just right there. That's it.
Oh.
Yeah. Who knew that was
It's
there?
way up there. I mean,
Right there. Right next to there you are. No, don't go past it. Stay right where I am. And that's it right there.
Okay.
I mean, that's the coracoid.
That's a coracoid process.
Yeah.
Right.
Don't move your finger.
Okay.
Right?
Yeah.
So my finger is pointing it off. Don't go off my finger. Go right where I am. Right?
And the AC is right on the other side of that, right?
It's really the very top of the shoulder. The clavicle is working its way up here, and that's where the AC is. So the anterior AC is obviously in the front of the joint. The posterior AC is in the back of the joint. That's going to be actually a little sore for you, isn't it?
It's not.
Not that sore?
I'm probably dead. That's a little.
That's a little sore.
Yeah.
Right. So we've looked at the lower, the inferolateral coracoid point. Now the anterior AC point is sort of similar. Yo, folks.
Yep.
Please, 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 please. The anterior AC point is revised, remediated, sort of similar to what the coracoid, the inferior lateral coracoid is, where I'm going to lock here, and I'm putting strong traction right? I'm not doing internal rotation, just straight traction. And the problem is what angle the arm needs to be. Is it parallel to the table? You know, and we've got tenderness, you'll tell. Sometimes with some people, you have to go across the body like so. Sometimes you have to go out and back and down like so. That's the anterior AC point. You start with it straight and see where you go. You can feel that she's had an injury because it's actually unstable. As I move her arm, it clunks and slides. Especially when I come over there, you can really feel the gap between the AC, between because I'm pulling the arm, which is dragging the acromial process, and it's coming to where the clavicle is. Now, the posterior point, you have to flip him over and do it from the back. So flip over real fast, please. And I come around. And it's analogously the same. Here's my point on the back part of the AC joint. Expose thy shoulder. Here's the AC joint. I'm on the back part of the AC joint. There's my point, and it's the same thing. I'm locking my elbow. I'm doing traction, and that clunked kind of nicely. But do I have to go up? Do I have to go back? Do I have to go over? Those you just have to fine tune. The one feature is you've got to really lock your elbow in and make traction, and then figure out what angles and give you the proper. And that has to do with how has the clavicle gotten turned and strained, and what else we're doing.
So the point should disappear.
The point should disappear eventually. You know,
And you're helping your client is helping you monitor by the tenderness of it? Or
well, like we do with every of these points, right? I put them in a position and I touch it and say, how's this feel? So no, it's no better. How about this? Oh, maybe a couple points better. Oh, no, it's still 4 out of 5. Oh, it's worse. So it's the same thing we do for all these other points. You keep tweaking it until the point at least gets to 2 or 3 or better. Okay? Good. On your back, please. So those are the AC points. That's the inferior coracoid point. Okay? We're just exploring points, right? I mean, we're just doing stuff. Pardon me, Jen? I'm going to show you the rotator cuff points that I use. One of the most common injuries with people involves a strain where the internal rotators go into spasm. Where what happens?
Internal rotators are in spasm.
Thank you. The main internal rotator we have to contend with the rotator cuff is subscapularis.
Ow.
Is what?
Subscapularis.
Now, remember our talking about subscapular adhesions, where we have to get under the scapula and kind of excavate it off, you know, that scapulothoracic joint that I talked about. Here is, let's see, who's got, do you have that, oh, you don't have it on anymore. Do you have that tank top underneath there? I do. Good. We borrow Jane for a moment. So the point, now, this is the scapula right here, right? And subscapularis is coming off the humerus and headed down, and the point is right on the leading edge of the scapula. I'm right there. Is that sore?
Yes.
Yes, it is. So slide over toward me. So it's an internal rotator, is it not? So the point is on, yep, that's it. And there I am on the edge of the scapula. And all I'm going to do is internal rotator, grab her humerus. There's nothing humerus about that. And then look how I'm just dropping my way. I'm not actively turning her with my muscles, but I'm just dropping her down. Gravity holding her, her arm is internally rotating her. And I'm retracting.
You're rotating the arm,
I'm bringing the arm straight back,
straight back.
and I'm internally rotating the humerus. And how'd that? Normally, I slide to the side a little bit more. A little bit, yeah, that's good. I like to have, so I can take them as far back as I want to. And you'll feel the point kind of float and the air get real soft. How's that, Dia?
It feels good.
Yeah. Yeah, this is a good point. It's a really good point. Very common shoulder injury.
Is she using your knee?
she using my knee? Are you using my knee?
No, I'm not.
No, I mean,
It's not resting on your leg?
It is now.
it
It
sort of is,
wasn't.
but are really nebulous to me. Are really what? Nebulous. What does that mean? Vague.
Foggy.
Foggy. Vague.
Not exact.
Nebulous is cloud-like, right?
Neighbor is
Yeah. So here's the scapula. What is this?
Scapula.
Twice. Did you change the battery type on the menu? Oh.